Hi, I'm Tailing from HiCura. My team helps doctors make better decisions by developing AI-driven solutions on image-guided procedures. Women all over the world choose epidural as their preferred pain relief choice during childbirth. However, it is surprising to know that 6 out of 10 women require multiple needle punctures for effective pain relief. Personally, I was left in fear, anxiety, and distress during my epidural due to multiple puncture attempts. Now, performing an epidural is challenging. For a safe and effective epidural, the needle entry position and angle are crucial. The optimal position is between the L3 and L4 spinal segments. If the angle of insertion is not right, the needle will hit the bony structures and a reinsertion is required. Multiple needle punctures can cause complications such as infection, vascular injury, and epidural abscess, etc. Despite these difficulties, doctors are still using techniques from a century ago, the landmark and palpation technique. This is where doctors use their fingers to feel the bones to get to the right position. It relies heavily on the interpretation by doctors. The needle goes in blindly, and is not effective for obese patients where you won't be able to feel the bones. Medical boards around the world are recommending ultrasound to assist the doctors to locate the right position and angle. However, the use of ultrasound is very low. This is because the doctor will require the help of a sonographer to perform the ultrasound scan, or he has to undergo extensive ultrasound training to be competent. But we have a better solution: uSINE. uSINE empowers doctors to locate the right position and angle on its own with minimum training. uSINE's automated machine learning algorithm identifies spinal landmarks in real time during an ultrasound scan. The instruction panel at the site guides the doctor to identify the L3-L4 interspinal level. In the transverse view, uSINE guides the user to find the midline and epidural space, and also automatically measures the epidural depth. uSINE has been proven to be effective and efficient in 2 clinical studies performed in KK Hospital. As compared to palpation, we see a large increase in the first needle puncture success rate with uSINE. uSINE also measures the epidural depth automatically, so the user is able to select the right needle length and know how deep to insert the needle. uSINE offers many benefits. To the hospitals, uSINE leads to better clinical outcomes, equalization across different skill levels of the doctor, and a shorter procedure time. For the doctors, uSINE results in higher efficiency and reduced stress when dealing with challenging patients. To the patients, there is better experience, especially for obese patients, and lower chance of serious complications. uSINE is the world's first AI-powered system to identify spinal landmarks, and it has great growth potential. Besides epidural, uSINE can also be used for other neuroaxial procedures. These include lumbar taps for disease diagnosis such as meningitis, spinal anesthesia for surgeries such as hip replacement or knee replacement surgeries, and intrathecal drug administration. Bringing a child into the world is a beautiful experience, and mothers are choosing epidural to relieve their pain. I did, but it was a distressing experience. uSINE has the potential to transform the current way doctors are performing epidurals. Join us in our journey to make epidural the way it should be. Reach out to us to find out more. Thank you.